My research area over the last 7 years has focused on diabetes and exercise, and I've published 5 different research papers on this topic alone. I've learned a ton about diabetes through my research and through this YouTube process of sharing my research and other researchers' work with you. In this video, I'm going to cover the top 10 things that I've learned about diabetes over the last 7 years. I'm Dr. Elise Brown. I'm a scientist who studies how exercise helps to prevent and slow the progression of diabetes. For all the points that I'm going to make today, I've already made videos about them, so I'm going to link them here. For some of them, YouTube only lets me do up to 5, but I'll make sure that I put links to all the videos down in the description. The first thing that I learned is that it only takes one strength training exercise session to lower blood sugar levels, improve other diabetes risk factors, and boost mental health. In people with diabetes, one of the most important aspects of health that they need to be aware of is how exercise impacts blood sugar levels. In a review that my research team conducted, we found that one strength training session can reduce blood glucose levels by up to 14.5% for up to 24 hours. It can reduce insulin levels by 48% for up to 18 hours. It's more effective than moderate intensity aerobic training or cardio in terms of lowering blood pressure. And if it's done 45 minutes after a meal, it can lower triglyceride levels in the blood by up to 92%. Now, exercise has to be done on a regular basis in order to increase these benefits and maintain these benefits, but it's pretty powerful that the effects are fairly immediate. The second thing that I learned is that diabetes and mental health are very closely related. And people with some mental health conditions like depression or schizophrenia, without any other contributing factors, these conditions can lead to the development of diabetes. And once a person has type 2 diabetes, this increases their chances of developing depression by 100%. Insulin resistance seems to be the common denominator here. With insulin resistance, like in diabetes, anxiety and depression may emerge because insulin resistance is thought to have a negative impact on dopamine production. And dopamine is a chemical in our body or a neurotransmitter that's linked to us feeling good. People with bipolar disorder are 1.6 times more likely to develop diabetes. And whenever blood sugar drops in diabetes, this situation is sometimes linked to panic attacks and experiencing delirium. Last point here on this topic, impaired glucose tolerance, which often leads to diabetes, is a common side effect in some medications that are used to treat mental health conditions. The third thing that I learned is that when it comes to developing a strength training program for diabetes, the details matter. Based mainly on a systematic review and meta-analysis conducted by my research team, we were able to identify characteristics of different strength training programs that we were consistently seeing in interventions that were effective in lowering or improving diabetes risk factors whenever strength training was done on a regular basis in people that were at risk for diabetes. We're talking improvements in A1C, cholesterol, triglycerides, and body fat. In the most successful programs, exercise frequency was 3 times a week, working every major muscle group each training session. But keep in mind, doing it 2 times a week, every major muscle group each session, that's still effective in improving insulin resistance and improving blood sugar levels. For intensity reps and sets, the intensity should be at least 60% of 1 repetition maximum, or 1 RM. And I explained what that terminology means in the linked video. And if you're doing it at this intensity, the 60% of 1 repetition maximum, your rep range is going to be between 10 to 15 reps. You can see greater improvements in A1C if you increase the intensity and lower the reps. And we were talking intensities of 75, 85, and 100% of 1 RM. And 2 to 3 sets of each exercise seems to work well. Free weights, machine weights, resistance bands, body weight exercises, all these are appropriate to include in a strength training session. And you want to make sure that the majority of the exercises that you incorporate are multi-joint exercises. Resting between sets for 2 minutes is going to be appropriate in most cases if you're training with a rep range of 10 to 15 reps. But if you're training at a higher intensity, you're probably going to need a bit more rest, at least 3 minutes between sets. Remember to turn on the notification bell so that you're one of the first to know when my next video comes out. Number 4 on the list is the fact that our environment can impact our diabetes risk and the likelihood of us being active. If you think about where you live, ask yourself, do I feel safe? Is there sufficient lighting outside? Are there sidewalks? Is there a community gym or a fitness park near walking distance or within a 10-minute drive from my house? Are the places that I go on a daily basis within walking distance? My research team, we recently published the first questionnaire that measures how our different aspects of the environment impact whether or not we participate in strength training. We found that people that had easy access to fitness facilities in their neighborhood, those that had strength training equipment in their home, and those that had people in their life that supported them when it came to strength training, these people were more likely to meet the muscle strengthening guidelines for Americans. Over the last few years, it's been pretty exciting to see the number of fitness parks or calisthenics parks that have been developed in the Detroit area. People are more likely to be active when they see other people being active. The fifth thing that I learned is that some strength exercises are more effective than others at improving diabetes risk factors. Like I mentioned earlier, the majority of the strength exercises in your program should be multi-joint exercises, like push-ups or like a leg press. There are 7 different movement patterns that should be included in a strength training program, and I'm going to give you examples of mainly multi-joint exercises from each category that can be incorporated into your home strength training routine. The first movement pattern is a knee movement, and so this is going to include any variation of a squat or a lunge. Second movement pattern is vertical push, and this is going to be exercises like a dumbbell press or a banded overhead press. Third movement pattern is a hip movement, and this is going to include most deadlift variations like a kettlebell deadlift or a banded sumo deadlift. Fourth movement pattern is going to be a vertical pull, and so you can do banded lat pull downs for this category. Fifth movement pattern is a horizontal push, and so this is going to be like a dumbbell floor press or a push-up. Sixth movement pattern, this is going to be a horizontal pull, so this is different types of rows like a dumbbell row or a banded row. And the last movement pattern is a torso movement, so these are things like sit-ups or abdominal crunches. The sixth thing that I learned is that walking is one of the simplest ways to lower blood sugar. In people with type 2 diabetes, walking is the most popular form of exercise because it's relatively low impact and safe. You can change it up by the speed or the incline, and it doesn't require any specialized skills. In type 2 diabetes, one walking session can lower blood sugar, it can boost mood and feelings of well-being, and it can also improve arterial stiffness, which is related to heart health. Even though blood sugar can be improved through one 40-minute walking session at a moderate intensity, and this includes a warm-up and a cool-down, blood sugar can be improved more substantially when doing high-intensity interval training, or HIIT. A walking HIIT program could look like this: 5 minutes of a warm-up, and then alternate 3 minutes of high-intensity walking with 3 minutes of low-intensity walking, and do this for 30 minutes, and then finish up with a 5-minute cool-down. In people with diabetes, if you're wanting to start exercising at a higher intensity, so doing HIIT training, you first need to make sure that you've already been exercising for the last few months at moderate intensities on a regular basis and that you've been cleared by your doctor to do so. If you want to help stay motivated and support the channel, please take a look at the merch link down in the description. The seventh thing that I learned is that there are multiple steps to take when ensuring safety with exercise and diabetes. In my video that covers the safety guidelines for exercising with diabetes, I covered 12 steps. And in this video, I'm just going to mention some of them here. The first step is to get clearance from your doctor to make sure that it's safe for you to exercise and to see if you have any limitations that you need to be aware of. And while you're meeting with them, also ask them about if you need to make any changes to your medication related to exercise, because sometimes insulin dosage needs to be lowered before exercise. You also want to check with them about exercise timing, so the best time of the day to exercise, because if you exercise late at night, you run the risk of going into nocturnal hypoglycemia, which can be dangerous. And then you also want to check with them about if you need to make any dietary changes related to exercise. Before you exercise, you want to make sure that your blood sugar levels are between 100 to 250 milligrams per deciliter. You want to make sure that you know the signs and symptoms of low blood sugar and high blood sugar. You also want to make sure that, or it's advised that you have a friend or a family member nearby when you're exercising, just in case a risky situation happens. Don't skip the warm-up or the cool-down. Make sure that you have appropriate shoes to exercise in, especially if you have peripheral neuropathy or or peripheral artery disease. Now, watch this video on these 12 steps to better understand all these points that I made here today in this video, as well as the other safety steps. The 8th thing that I learned is that our grip strength can predict whether or not we have type 2 diabetes. Grip strength is measured by a device called a hand grip dynamometer, and it's a tool that you squeeze as hard as you can, and it measures the force that you're exerting. Normalized grip strength is somebody's grip strength divided by their body weight, and the reason that we would normalize grip strength is it allows us to compare diabetes risk using grip strength across people of different body weights. My research team, we developed grip strength cut points for detecting type 2 diabetes risk in adults, and we did this using the NHANES, which is the National Health and Nutrition Examination Survey. The NHANES is a large, nationally representative health survey that's been conducted in the U.S. since the 1950s every year by the U.S. National Center for Health Statistics. We found that normalized grip strength predicted type 2 diabetes risk, and these cut points can be used as a diabetes screening tool in adults. The 9th thing that I learned is that some types of exercise training are better than others at reducing belly fat. Higher amounts of belly fat increases the risk of developing diabetes and heart disease. Exercise is a great way to reduce belly fat, and the intensity of that exercise matters. There was a 2023 meta-analysis of 84 randomized controlled trials that were examining different types of exercises or exercise training that were effective in reducing visceral fat, which is the fat that's found around our organs, in people who were either overweight or obese. And the total meta-analysis included just under 5,000 participants. They looked at moderate intensity cardio, strength training, and HIIT. Now, they found that all 3 of these different types of exercise training were effective in lowering visceral fat and subcutaneous fat, which is the fat that's found underneath our skin, but the most effective were high-intensity cardio and HIIT. The 10th and final thing that I learned is that exercise is crucial for women with gestational diabetes. Given the uncertainty of weighing the risks versus the benefits of exercise during pregnancy, many women will avoid exercise during this critical developmental period. After pregnancy, the mother has an increased risk for developing high blood pressure and type 2 diabetes. Thankfully, the risks of developing gestational diabetes can be greatly reduced during the pregnancy through exercise. Exercise during pregnancy has a number of positive effects on the baby. Some of these benefits include a better cardiovascular response to a single exercise session by the mother, increased levels of amniotic fluid, which is important for the baby's development, and enhanced brain development. Exercising before and during pregnancy decreases your chances of developing gestational diabetes. If you're planning on becoming pregnant, exercising for at least a year before becoming pregnant reduces your risk of developing gestational diabetes by 76%. Once again, links to videos on all these topics are in the description below. Thank you for watching.